Hello, my name is McCaa, and I am a college of nursing student at the University of South Alabama, and today I'll be performing my medication administration check-off. Before I begin, I will allow my assistant to scan my room and also show my volunteer for my injection sites. Before I go into the no interruption zone, I will perform hand hygiene, and now that I'm here, I will check the patient care order form and the MAR, or the medication administration record, to make sure that everything lines up. Okay, I have Mr. Jaguar Jones, allergic to penicillin. Date of birth is August 25th, 1963. Date of birth, August 25th, 1963. Medical record number is 417-6352. Medical record number is 417-6352. Today I'll be administering heparin at 5,000 units subcutaneously every 12 hours. I'll be administering 5,000 units of heparin subcutaneously every 12 hours. Now I will leave the no interruption zone and head to the medication room to receive my heparin. I will be performing hand hygiene, and I will check my medication record and order form once again. I need heparin at 5,000 units subcutaneously every 12 hours. Heparin at 5,000 units subcutaneously every 12 hours. I will perform hand hygiene, and I will retrieve my heparin. Here I have heparin at 10,000 units per milliliter. The expiration date is December 5th, 2025, and it is not expired. I will make sure that I have everything lined up before I retrieve everything. I have heparin at 10,000 units here, but I have heparin I need to give it at 5,000 units. So if my calculations are correct, I'll be giving heparin at 0.5 milliliters. So I have heparin at 5,000 units subcutaneously every 12 hours, and I'll be giving 0.5 milliliters. Heparin at 5,000 units subcutaneously every 12 hours, and I'll be giving it at 0.5 milliliters. Alright, I'll perform hand hygiene once again, and I will use my alcohol pad. I do not have any alcohol pads, so I'll be using a paper towel, and I will wipe around the vial and the inserting point. Then I will disregard the alcohol pad, and I will retrieve my 1 milliliter tuberculin safety syringe to get my medication. Now I will retrieve 0.5 milliliters of air before I begin. 0.5 milliliters of air. I'll remove the cap and place it on the countertop. I will insert the air into my vial. Now I will retrieve 0.5 milliliters of of the medication. I'll get a little more than I need just to be able to insert a little more. And 0.5 milliliters of my heparin. Alright, and now I will remove this, and I will place the lid on. Alright, now that I have my heparin, I will take everything and I will get it checked out by another nurse, and she says that everything is okay. Now I also do not have any tape today, so I'll be using a bandage to write the patient's name, the medication, as well as the dose. So I'll be writing Jaguar Jones, 0.5 milliliters, and heparin. And I will wrap it around my syringe, so I will know that this is what I'll be giving my patient. All right, next I will go on to show my injection sites on I'll be showing my injection site on my volunteer. So I have my volunteer here, and I will be giving my dose of heparin subcutaneously. So on my patient, I would give it at the umbilicus region, so I'll be at the umbilicus, or I will go either 2 inches to the right or 2 inches to the left of the umbilical region, or I could give it on the the anterior portion of the thigh, or I could give it on the back of the arm. I have the elbow here and located the bottom of the deltoid where it inserts into the bone, and this is where I'll be giving the medication. If I was doing an intramuscular injection, I would locate either the deltoid muscle here. I have the McCaa process, and then I will locate 3 fingers down and place my V here, and I will insert it here. Or I could go to the vastus lateralis, which is the midline of the anterior portion of the thigh, and then the midline of the lateral portion of the thigh. We find the knee and the greater trochanter and the rectangle that makes up the space between the midline and the other landmarks. That is where I would place my vastus lateralis injection. Or I also have, let's move. Okay, I would locate the greater trochanter once again with my right hand. Place my thumb facing the abdomen. Find the anterior superior iliac spine and locate the iliac crest with my middle finger, and I would inject here. All right. Thank you. Next, I will go on to my patient's room with my paperwork as well as my injection, and I would also take my vial with me. I will go into the patient's room, perform hand hygiene, and make sure that I have the right patient. Jaguar Jones, allergic to penicillin. Jaguar Jones, allergic to penicillin. Date of birth is 08/25/1963. 08/25/1963. Medical record number is 4176352. Medical record number is 4176352. I would check my information one more time. I have heparin. I have 0.5 milliliters of heparin on my tape, and I needed heparin given at 5,000 units subcutaneously every 12 hours. Heparin given at 5,000 units subcutaneously every 12 hours. I have 10,000 units of heparin here, and my calculations were to retrieve 0.5 milliliters of heparin, and that is what I have here, and that is what my nurse checked as well. So I would go to Jaguar Jones, and I would perform Jaguar Jones' room and perform hand hygiene, and I would let him know what I would be doing and tell him that the heparin is for his blood clots. I would don my goggles and my gloves. I also do not have an injection pad, so I will be using the patient's arm, and well, I'll be using this as the patient, but I know that I will inject it 2 inches from the umbilicus on the left or right side. I will raise the bed up to a level working height. I will lower the bed rails and make sure that my patient is comfortable. I will retrieve my heparin and discard of both of the containers. Discard of the container. I would wipe down the injection site, and I would pinch the patient's, well, in this case, it would be the patient's skin, I guess you could say. But if I was using the patient's umbilical region, I would pinch the fatty portion of the skin on the umbilicus region. I would inject my heparin at a 90-degree angle right into the patient's, and I would inject all of my heparin, slowly, making sure that I got all of it. And I would discard of this in the sharps container. I would ask the patient if I would know any allergic reaction, well, any direct allergic reaction. I would ask the patient if they feel any pain or anything, and I would lower the bed and raise the rail. I will remove my gloves and discard them, and I would remove my goggles and perform hand hygiene once again. And I would, before I leave, I would ask the patient if everything's okay, making sure that the patient is comfortable for now. And I would leave, but I will also come back later on to check and see if there's any issues with the medication I gave him. I would document the time I had gave it to him. I would document any discomfort the patient felt, any allergic reactions or anything. And that's the end of my checkoff.